Thank you. Once again, since we started the recording before I said my name is Sarah Tunnell. I use she, her pronouns, and I'm the Senior Project Manager for Apple Health Expansion. Welcome to our webinar this morning, where we'll be discussing provider information for the upcoming Immigrant Health Program. This webinar is being recorded, and by staying in the webinar, you consent to being recorded. This is a Zoom event and webinar mode. Attendees will not have microphone or camera access during this online event. Attendees' voices, likeness, and/or images will not be captured. Special thanks to Erin Griffin for ASL interpretation. Closed captions are available in English and Spanish, and we will share the closed caption links several times throughout the webinar. There will be a live Q&A at the end of the presentation. All web pages and additional resources will be shared at the end of the slide deck. Your first presenter this morning is Becky Carroll, Deputy Assistant Director of Medicaid Programs at HCA.
Good morning, everyone. Thank you, Sarah. Appreciate everybody joining us on this webinar today. I hope we cover pertinent information and are able to answer many of your questions. If you want to move forward to the next slide, we're here today to talk about Apple Health Expansion, which is a new program with benefits launching beginning July 1st. Our enrollment for this program started last week. It is a limited enrollment program, and we did meet our goal, our cap for enrollment for our 19 to 64-year-old population as of 4:30 on Friday, June 21st. We do have a limit for enrollment for those who are 65 and older, but that enrollment continues today. We still have spaces available for those who are 65 or over, and we have information here. They can apply via Washington Connections or by paper through our partners at the Department of Social and Health Services. We update our enrollment announcement, which is what you see here in sort of this pale yellow color at the top, whenever there's a change in the enrollment. And so you can see that here at the link hca.wa.gov. We want to move forward to the next slide. So wanted to sort of set the stage here a bit. Immigrant healthcare coverage has been something that has been central to Apple Health for a while now. Since the Affordable Care Act, Healthcare Authority has been serving immigrants through Washington Health Plan Finder and our Washington Connection application systems. We've had over 100,000 immigrants interact with the application system over the last year, and there are 43,000 individuals without an immigration status who are eligible for Apple Health for Kids and Apple Health pregnancy medical programs. Next slide. Our current immigrant healthcare coverage includes 5 different programs: medical care services, emergency medical care, and Apple Health for pregnant individuals, and after pregnancy coverage. We also currently serve kids who are 0 to 19 under Apple Health for Kids. This latest investment in immigrant healthcare coverage is at the direction of our legislature. In 2022, we received funding and direction to begin operationalizing to create a program that mirrors our integrated managed care program here at the Healthcare Authority. That happened in 22. In 23, we received service dollars as well as a direction to begin that program on July 1st of 2024. And to be very specific, the language noted, right, that we are providing equivalent medical health care coverage to uninsured adults who are otherwise ineligible for federal assistance. A couple of key notes here. We did not receive full funding for the program, and we recognize here as a state, at the state level, that there are more community members who would be eligible for Apple Health Expansion than there are spots available in the program right now. Next slide, please. So who is eligible? Apple Health Expansion was designed to serve individuals who are 19 years of age or older, whose income is at below 138%, at or below the 138% of the federal poverty level, and they're not eligible for other Apple Health programs based on their immigration status, or qualified health plans with advanced premium tax credits or federally funded medical programs. So managing this enrollment has been a little different. Apple Health expansion, like I noted, is limited. Once the limit has been met, an applicant who is otherwise eligible for the program will receive a denial due to that cap being met. All clients who are eligible for Apple Health expansion are also eligible for a qualified health plan, should be eligible for one, to purchase over the health benefit exchange. Noting here that clients under 250% of the federal poverty level are eligible for Cascade Care savings if enrolled in the Cascade Care plan. In the event that the program loses its funding, Apple Health expansion to be specific, and or its funding becomes restricted, HCA will notify clients, providers, MCOs, key stakeholders, and the community at large. We're going to be providing additional details about that process in early fall. But again, just noting this is a limited enrollment, limited budget program that sits in the Washington state budget at the moment. You want to move to the next slide. We do have a short-term enrollment management policy. This policy is in place right now to address individuals who were otherwise eligible for Apple Health expansion, but were not enrolled because we had met our enrollment cap. Essentially, anybody who applies for the program and receives a denial and submitted a completed application on or after June 20th, or if they were enrolled in Apple Health for Kids, emergency medical, after pregnancy coverage, and they meet the eligibility requirements for Apple Health expansion, and their coverage in one of those programs has ended, but were able to enroll in Apple Health expansion due to the cap, or if individuals have a QHP, qualified health plan through health benefit exchanges 1332 waiver and applied after April 30th, they would be put into a pool, and as spots are available in Apple Health expansion, a random selection would be made of those applications. This policy is in place for the first few months of the program. They're working on a longer term policy with the eventual goal of having an IT-based solution waitlist. Want to move to the next slide? The overarching goals of the program is to create a program that is as much like our Apple Health Medicaid integrated managed care program as possible. We obviously also want to provide coverage to as many eligible individuals as possible. So those are our two main goals. And I'm going to ask Colette Jones to walk us through how we've created our benefit package to meet those objectives. Colette?
Thanks, Becky. Hi, all. I'm Colette Jones. I'm a manager at Healthcare Authority and a nurse by background. I use she, her pronouns. Next slide for us, please. So I want to give you an overarching understanding of how the benefits are designed so you understand how much it aligns with our current Apple Health integrated managed care structure, and call out just a few key differences that you'll need to know. So on the screen today is a general concept around what covered services we have. Again, this is intended to mirror that federally funded Apple Health program as much as we are able. Things that are similar and familiar to you might be physical health and behavioral health services that will be administered by an Apple Health plan, just like they do in that integrated managed care structure. And then dental services will be covered directly by the Healthcare Authority, by Apple Health, as they are today for our other populations. The non-emergency medical transportation program and interpreter services will be available. We'll talk about that a little bit more. And the pharmacy benefit is available. That's the Apple Health Preferred Drug List, or the PDL. Next slide, please. Here are the 4 managed care plans that will be serving our Apple Health expansion population. We'll hear more from them later today. This is Molina Healthcare of Washington, United Healthcare Community Plan, Community Health Plan of Washington, or Coordinated Care of Washington. Next slide. There are often some questions around privacy rules for this program, so we want to just put some basic information and give you more references to dive into more information if you need it. Generally, a healthcare authority is required under law and HIPAA to maintain privacy of its clients' information. There are a limited number of reasons where healthcare authority may use and disclose information, including determining eligibility for Apple Health coverage. And the privacy practices listed below are provided to clients on a yearly basis, and we don't share information with any immigration agency. And then there's some resources for you to dive into later. Next slide, please. In that same vein, there could be questions around the public charge test and the rules that apply. If you want to learn more about that and how this program, what our policy is around that, the information is here for you. I'm sorry for my dog. Next slide. Okay, so some key points for providers to take away. Just like a typical interaction, you want to check individuals' eligibility through Provider 1. It's good to know that Apple Health Expansion enrollee cards don't identify the specific program they're in. They will look like another Provider 1 card you see today. There are some differences in coverage. For example, there are services that are normally paid by the Department of Social and Health Services or DSHS that are not covered for this program. We'll talk about that a little bit more. And then Apple Health Expansion enrollees cannot access Healthcare Authority's Interpreter Services program, but each MCO or each plan has arranged a contractor to provide interpreter services for this program. Next slide. Okay, some other general principles here around the benefit coverage. It generally mirrors that Apple Health Medicaid program, so you can put that hat on and use that as your guideline. And the medical necessity requirement that we use for Apple Health programs stands as applicable here today, and that is available for you in that medical necessity WAC. And then the benefits that are available for 19 and 20-year-olds, just calling that out, we'll talk about that a little bit more. They are set up to mirror the HCA benefit structure as much as possible. And then there's some other general practice things that may or may not be familiar to you, and they apply here too, like the U.S. Preventive Services Task Force. I think I have that acronym just a little wrong. Anyway, USPSTF. That applies. We have health technology processes to apply here that connects to. And then the second opinion allowance, the self-referral allowance, providing care that is in country, in or out of state, all of those apply. That was a lot. Okay, next slide. All right, some other general construct for you. Other state agency services that Apple Health Services are delegated to are generally excluded as being unfunded. We'll talk about those a little bit more detail. But another general structural question to think about is anything that is provided through an allowance of a Medicaid waiver are not covered in this program. They're excluded as unfunded. Here's some examples on screen for you. I'll leave that as a reference point for you. Next slide. Okay, general pharmacy coverage this is covered and carved in. That means that our health plans cover pharmacy just like they do, mirroring that Apple Health managed care structure. And these are what you know today to serve our Apple Health population in that Apple Health preferred drug list using FDA approved prescription and over-the-counter drugs that are produced by rebate eligible manufacturers. Same status quo. Also, I'll note in part of that pharmacy benefit is medical and diabetes testing supplies are also on that PDL. There are certain things that are excluded or carved out, and those are available in the contracts or the PDL if you need details. Next slide. General principles for physical health coverage. Again, this is covered and carved in, meaning the plans provide these services to our Apple Health expansion clients. They align with our managed care structure and include things like emergency care and hospitalization services. And they mirror the typical design of how that program is administered in managed care. We'll talk about that more. Other examples are like fitting fees for eyeglasses are covered in that structure. Also, birthing services, pregnancy and postpartum. These clients will be able to report this and be eligible for our pregnancy medical program. But we do provide these services through the plan here. Next slide. So there is a portion of care that is Medicaid eligible, and it is through a program called Apple Health Expansion Emergency Medical Care. This is more of a funding distinction, and care should be seamless for these individuals. And just letting you know that some piece of this program is supported through our Medicaid structure, and so we're leveraging those funds as much as we can. Our next slide, please. Behavioral health, major concepts. These are covered by our plans, same structure. They cover the full continuum of mental health services that we do today. In case you're familiar with our SERI or service encounter reporting instructions and our mental health billing guide, those are both resources that support this population as well. Also covered services are substance use disorder treatment, applied behavioral analysis, and crisis services. They all operate in the same structure. Sometimes there's questions about how we support models of care, like our Wraparound for Intensive Services or WISE program. Those are covered just the same as we do for our Apple Health program today. Next slide, please. There are pieces of our behavioral health structure, just like we do with our Apple Health managed care structure. There are pieces that are covered directly by the Healthcare Authority. Here's an example of that. Our long-term civil commitments, or LTCC program, are contracted directly with the Healthcare Authority and provided that way for this population too. Next slide. Another piece of this puzzle, this is an interesting puzzle, but this is a slide to tell you this operates in the same way that it does for our Apple Health program today. This is a contract we call our Wraparound contract, but basically this tells you that there are services that are operated by our plans for additional pieces of behavioral health, like room and board for behavioral health care, and that model of care I was referring to earlier. Those are things that are prioritized in our delivery system. Next slide. Dental care, another one that mirrors very closely to our Apple Health integrated managed care structure, where we have certain pieces that are covered by our Apple Health plans, and most of the dental care services are set up directly with Healthcare Authority through our fee-for-service program. This is going to operate in the same way as it does for Apple Health individuals today. Next slide. I did want to have a moment to focus on our 19 and 20-year-olds. As a reminder, the eligibility for this program is 19 and over. So our 19 and 20-year-olds sometimes get a question about how we will address that care. And I want to make sure that you're aware our EPSDT, or Early Periodic Screening, Diagnosis, and Treatment, long federal rule. It is a Medicaid regulation. and it does not apply to Apple Health Expansion. However, the benefit structure that we've created for the Apple Health Expansion program is set up to mirror the coverage as much as possible for those HCA pieces. So some examples are on screen. Things that are covered are like chiropractic care, wellness visits, vision hardware, orthodontics, and then things that are covered by other agencies, so excluded for this program, are listed here as well. Next slide. There are other services I mentioned before that are covered for this population and carved out, meaning that it is provided by healthcare authority directly. So medical transportation is covered, and there's certain services you might be familiar with that are provided directly by the healthcare authority, and that will be available here too, like transgender surgery is an example here. And then also vision hardware is one of those examples where it will be provided directly from healthcare authority. Next slide. Here's another example. Some reproductive health services are also those that are currently provided directly by healthcare authority for our Apple Health Managed Care clients, and will be the same structure for this population as well. Details are on screen, and our Apple Health plans are always available to help support access to care and coordinate services as needed for these. Thanks. Next slide. Another piece of the puzzle, just to call out for you, there's coverage for our nursing facilities. And the things that are covered are medically necessary skilled nursing facility stays that meet the rehabilitative or skilled nursing services. So this is a client recovering and rehabilitating, right? Needing that skilled level of care. This mirrors our structure today. There is a piece of the program that is excluded because it is not funded for any other agency pieces, right? So this is a current piece of the puzzle that our DSHS partners provide today for our Apple Health members and was not funded. And that is like the long-term nursing facility piece. So clients that need ongoing supportive services are not covered in this program. I will mention that DSHS does have a limited number of beds that provide this service for this population, and a waiting list may be applicable, and that program was not impacted by this program go live. Next slide. All right, language access. So calling out that the language access footprint is a little different for this population, but is available, and that's critical for this population. So we want to make sure that you providers are aware how to access that. So our typical HCA interpreter services program that you interact with today will not be available for this population. And that is because it is a Medicaid funded service. So we have worked with our plans to make sure that this service is available to support this population. And it's the responsibility of plans to make sure and communicate that to our providers to ensure that access point is there and secure language access for this population. And again, no cost to the enrollee, just like it is for our Apple Health program today. So providers should know and follow the process for contacting plans. So I want to flag this for you to make sure that you're aware how to do that. And providers will should share this with their internal staff so you can make sure that you can meet the needs of individuals today. Next slide. Okay, there are services that are not covered, and those, just like it is in our Apple Health program for managed care, are listed in our Washington Administrative Code, or WAC, and this mirrors those benefits that are not covered today, and a resource is there if you want more details there. So that is a much mirrored structure, and calling out also the billing guides are really helpful resources in understanding the nuances of benefits available. And specific to this program, Our usual billing guide update that typically happens every quarter will address the Apple Health expansion nuances starting July 1st. Next slide, please. Okay, as we've talked about a bit before, here's a little bit more detail about benefits that are excluded as unfunded in this program. These are benefits that are typically delivered by other state agencies and were not allocated funding in that state budget. You can read those details on screen, but wanted to make sure you have that in your structure. Next slide. Here are more examples of pieces that are not available for this population. And I think we can leave that there for today. Next slide. Here's some other nuance notes in case this is applicable and helpful to you. We have a certified public expenditure program that applies to our Medicaid structure. It doesn't apply to this population. Clients can continue to receive care in hospitals as usual. And then retroactive enrollment is a concept that we use to support connection to a plan as soon as possible. This applies differently in this population. Retroactive enrollment does not apply in Apple Health expansion, so clients don't get prior month eligibility. It will be handled prospectively. And there's some nuances here, like a hospitalization that may be applicable to you to read more. And there may be pieces of care that are covered under that Medicaid piece under the AEM program Becky introduced in the beginning. I'll also say that incarceration will be similar to how our current Medicaid footprint is today. Their eligibility will be suspended, and that means that hospitalizations for inpatient care is covered for those individuals, and then services resume at release. Next slide. Some other nuancy notes for you in case this is helpful for you in understanding the program. There is a population of extended foster care who are 19 to 20-year-olds. They may be served in this program. There are block grant services that are funded by our federal partners, and they are available through our Behavioral Health Administrative Services Organizations, our BHASOs, and this population can access those services. There are some additional benefits available through our health plans, and they may be available for this population, and plans can communicate that as they have availability. Next slide. I'm going to turn this back to Becky for more information. Thanks.
Thank you all. So these slides really point you to some previous webinars that we've held around Apple Health expansion. So we've been holding webinars since November, and you can find links to these webinars on our webpage, and I think someone's putting that into the chat right now. They are available in many of our core languages, as you can see over there to the right. Next slide. We also have a communications toolkit that provides social media, branding, and language guidance, some key messaging, and some previews of letters that will be sent to the Apple Health expansion population, if that's helpful. Also, again, available on our website, which I believe is now in the chat as well. Next slide. We also have a social media toolkit that you'll find that provides multiple photos and social media posts in 15 different languages to promote Apple Health expansion. Next slide. And we encourage folks to sign up for our Gov delivery message. These are our automated emails. And in order to receive those, you do need to sign up. And so that link will be in our chat as well. Next slide. Perfect. And this is an overview of all of the resources. I'll note that after the webinar, we will post these slides, so folks will have accessibility to them. Next slide. Perfect. Next, I will hand it over to our Apple Health Expansion Health Plans. First up, we have Lindsay Green from Coordinated Care. Oh, I'm so sorry. I apologize. Kush from Community Health Plan of Washington is going first. My apologies there. Go ahead, Kush.
No worries. Good morning, everyone. We could go ahead and move on to the next slide here. And go ahead and feel free to click through. So we are founded and governed by the community health centers with roots in the social justice movement. For Community Health Plan, the whole health of our members is our primary concern and focus. We are a local not-for-profit, so that means we do reinvest back our profits back into Washington communities to support the amazing work that's done at the ground level. And our local staff and board are part of the fabric of the communities we serve. Many folks know that over 51% of CHC boards consist of patients, and it allows us to integrate with community health centers to work hand in hand to break down barriers to care, focus on the whole person health, and advance equitable healthcare for all in Washington state. Next slide. We are centered on our community to deliver better health. We not only have local staff who know Washington state, who live and reside in the communities that we serve, and that's part of us being local. We deliver care that makes a difference by breaking down barriers to care and addressing inequitable access in our healthcare system. We do offer multiple healthcare plans for continuity of care. We now offer that fourth plan of Apple Health Expansion to ensure that we're providing consistent and quality coverage for Washingtonians at every income level and addressing all of their social determinants of health needs. And we're pretty flexible and very, very flexible and responsive to our approach, whether it's working with members or providers or community partners, always taking that work back to Community Health Plan of Washington and learning from that. Perfect. We can go to the next slide. So we do offer, again, as we mentioned, 3 plans, and we will be offering Apple Health Expansion. And so we operate in all counties in Washington state for Apple Health. It will be exactly the same as Apple Health Expansion. And our provider network is searchable on our Apple Health provider directory. So if you're interested on kind of those pieces, please do and check that out. We've also extended our value-added benefits. So any benefits that we offer to Apple Health members, we're offering to Apple Health Expansion members as well. This includes free eyeglasses for adults. It includes acupuncture. It includes chiropractor visits and massage therapy visits, among others. There are also other benefits included, such as access to virtual care whenever that is needed. Next slide. Now, for Community Health Plan of Washington, we are going to be providing our own interpretation services, as mentioned, for this Apple Health Expansion group. So for in-person telephonic interpreter assistance, that is going to be through Lion Bridge, and that number is going to be available on the back of those member ID cards. So if someone just walks in, same-day appointment, need care, that is the line you'll want to call. However, for pre-scheduled appointments, you can our language line will be our vendor, and they'll be providing in-person interpretation, virtual interpretation, and American Sign Language interpreters. Please make sure that in terms of language line, you are pre-scheduling those ahead of time to give them the ability to make sure that they get someone in person or virtually to support that appointment. Next slide, please. We're also working on provider training here at Community Health Plan of Washington. One of the important pieces to us is making sure that this work is longitudinal. This is a new population that we're serving in this type of way in terms of managing their care. And so we want to make sure that we are working with providers and community-based organizations to develop a training plan where we can all learn together. So we have provided a survey that has gone out to our community-based organizations and providers. We are working on developing a training plan as we speak, where we're integrating community health centers and providers and community-based organizations that could bring a lot of knowledge to this space. And to the next slide, we have some foundational training that is now available around immigrant and refugee health. This is led by Dr. Gino Eisenberg from the University of Washington Center for Latino Health. There are still 2 dates that are available. One is for for leadership, so that is CEO, operations, could be clinic managers, clinic supervisors, and that is on Thursday, August 1st from 10:30 a.m. to 12 p.m. And then there's another one available for direct service providers. So that's your physicians, your nurse practitioners, mental health therapists, community health workers, those that are member facing on Tuesday, July 30th, 10:30 a.m. to 12 p.m. And so this training is really going to be the foundational for what is going to come after, where we focus on specific topics related to immigrant and refugee health. Thank you all for having me, and I'll turn it back over to Becky.
Thanks so much, Kush. Appreciate that. Next up is coordinated care and Lindsay Green. Lindsay, go ahead.
Thanks, Becky. Hello, everyone. Lindsay Green, Medicaid Program Manager at Coordinated Care. Coordinated Care is statewide for integrated managed care, integrated foster care, and now Apple Health expansion. Wanted to highlight value-added benefits here first. And then we'll definitely talk about the interpreter services request process for providers as well. So we want to make sure that Apple Health expansion members will receive all applicable value-added benefits when they meet the eligibility criteria for those benefits, because we're trying to mirror IMC wherever we can. So the My Health Pays Rewards program will be available for our Apple Health expansion members. This is where when a member completes a qualifying medical appointment, like an annual well visit or a flu shot, breast cancer screening for members over the age of 40, cervical cancer screening, follow-up after hospitalization for mental illness, and a few others. When we receive that claim, the member gets a reward that's loaded onto a bright green Visa card that comes to them in the mail that they can use at Walmart, or for everyday needs like rent, utilities, childcare, phone bills, those kinds of things. Also, for members under 21, they have a glasses benefit through the state, but for our members 21 and up, when they use a in-network vision provider, involved vision provider, they can get $100 to apply towards glasses or contacts every other year. And then in addition, we have coordinated care harvest bucks. Members are eligible for a $10 voucher that they can use at Safeway for fresh or frozen or canned fruits and vegetables. And members can access that by giving us a call, or members or providers can email foodrx@coordinatedcarehealth.com. Boys and Girls Club doesn't apply for this population, right? Because Apple Health expansion is 19 and up. SafeLink also doesn't apply because it's a federal program that requires a social security number to enroll. But wherever we can, we're going to extend value-added benefits to the Apple Health expansion population. And next slide, please. Yeah, so just a heads up, if you are not Zoom webinared out after this call, you can join us from 12 to 1 for our provider lunch and learn. And I can put that registration link directly in the chat for everyone when I'm done speaking. And then the interpreter services, I think this is probably where people are going to want the most information. So providers can request interpreter services for Apple Health expansion members by completing the interpreter services request form and emailing it to this new email address, interpreterrequests@centene.com. The form is up as of Friday on our Apple Health Medicaid forms section. It's one page. It should be pretty simple and easy to fill out. And you can, submit that to us by email. If you prefer, you can also call us. And we can take that request via phone as well. So just a little screenshot there to show it's the second form that pops up when you use the little caret under Apple Health Medicaid forms. And then also just want to highlight on our website, there's a link here. We also did a bonus news edition all about Apple Health expansion. So we have an FAQ in there and just lots of good information that you might want to take a look at. Interpreter services, I think the only other thing I want to add there, we do request 5 days advance notice for those appointments if at all possible. So requesting 5 days notice for that. And I think that's all I have, Becky. Thanks so much for the opportunity to share a little bit.
Thank you, Lindsay. Really appreciate your time today. Next, we have Molina of Washington, and I think we have Audrey with us. Audrey, go ahead.
Thank you for having me this morning. I'm Audrey Silliman, Director of Provider Relations with Molina Healthcare. If you could go back one slide, please. Thank you. Just a little bit about Molina. I'd say first and foremost, just want to say Molina is thrilled to be one of the 4 MCOs going to be serving this population starting 7/1. A little bit about us and our background. We've been doing business in Washington for over 20 years. We're the largest Medicaid managed care organization in the state and serve over 900,000 residents of Washington. We are present in every county, and we're very proud of our achievements in quality. We are currently #1 in client choice, as well as #1 in provider satisfaction. Next slide, please. Lots of good detail shared by my partners today. We're just going to focus on interpreter services, but Molina has several resources if you want to learn more about member value added benefits, or we've got some cool training opportunities related to health equity and providing culturally responsive care. I've got some information on that in a couple of slides, but to focus on the core of the content, interpreter services, Molina offers interpretive services. Providers are able to call in and arrange services for Apple Health Expansion members, both virtual and in-person services. This is, I want to call out a list of languages that we've recently added to better support this population starting on 7/1, but it's not an inclusive list. We also offer services in a variety of languages, including Spanish, Russian, Ukrainian, Arabic, Vietnamese, and others that aren't listed here. We just couldn't fit them all on the slide, so wanted to highlight the ones that are newly available beginning 7/1. When you call in to arrange for interpreter services, there are some critical pieces of information that you're going to want to have in order to get those services set up. I've listed them here, but crucially, member name, ID, the language the person needs to communicate in, what type of visit, if you would prefer in-person or video, type of appointment, and the specialty of the provider who is going to be rendering services, medical necessity, date, time, appointment duration, and then your contact information. And then just a few more tips for arranging interpreter services. We've got our phone number here. Give us a call and we can coordinate with you to arrange either in-person or video interpretive services. We ask that you give as much advance notice as possible, particularly for in-person, just so we can ensure we get somebody there. So typically best practice, video phone call, minimum 24 hours advance notice, in-person, minimum 3 business days advance notice. And I'll add that sometimes I know it can be hard. You got somebody who's in for an urgent same day appointment. We will absolutely do the best we can to accommodate. Just, the more advance notice, the more likely we're able to get you connected to those services. And then this is just a slide of some folks you can reach out to. These are our provider relations reps. Feel free to reach out if you have any questions about the program. I'll also add that last week, Molina held a in-person or a webinar training on Apple Health Expansion. We will be posting those slides shortly, as well as an FAQ of a lot of questions that we've been getting from the provider community. Those should be posted on our website before 7/1, and we will likely also be sending out some announcements in our newsletter. And again, that's where you can find additional information about value-added benefit coverage, trainings on providing culturally responsive care, among other great topics. So be on the lookout for that, and don't hesitate to reach out to me if you have any questions. My email is included on the slide, or you're welcome to reach out to your provider relations representative. Thank you.
Thank you, Audrey. Appreciate that. And we have United Healthcare Community Plan. And I think today we have Valerie.
This is Tiffany Miller with United Healthcare, and I will be running through the deck today.
Thanks, Tiffany. Appreciate that.
You bet. As mentioned, my name is Tiffany Miller, and I oversee physician and medical group contracting in Washington. I appreciate the opportunity to present to you all today. United Healthcare's community plan serves nearly 230,000 Apple Health Medicaid members and about 74,000 DSNP members by offering integrated managed care with physical and behavioral health services. And our community plan serves on the accountable communities of health and supports the goal of health equity by meeting the member where they are with the individual services they need. We look forward to partnering with the HCA and our provider community as we serve our new Apple Health Expansion members and help them live happier lives, happier and healthier lives. Next slide, please. United has an ever-growing footprint. We continue to recruit and expand our network for all of our lines of business, which include Apple Health Medicaid, the new Apple Health Expansion, commercial, individual and family, as well as Medicare Advantage, which is where our DSNP line of business falls into. We bring new providers, groups, and facility, as well as ancillary services into network routinely across the state. We currently have the pleasure of serving our Apple Health Medicaid members and very soon our expansion members in these 6 regions and DSNP members in 30 counties. Next slide, please. Our community plan has specific online resources for members and providers alike. The links are in the deck, and these sites are in the process or have already been updated to include the Apple Health Expansion information. For those still in the works, that will be live by 7/1. Next slide, please. Wanted to make sure our provider partners had information on our provider advocates. And this slide has an overview of our behavioral health advocate assignments, and those advocates are assigned by region. Our medical providers can reach an advocate by using the chat feature within the provider portal, and the provider portal can be found on hcprovider.com. Our community plan has a dedicated line for Apple Health Expansion member interpreter services. The appointments can be in person, over the phone, via video, and also sign language. It's recommended to call 3 to 5 days in advance, and I will put this information and that phone number in the chat. Back to you, Becky.
Thank you, Tiffany. Appreciate you participating today as well. Thank you to all of our plans. Next slide, please. All right, and I think we're ready for our live question and answer period. Sarah, did you want to go ahead and lead us through that?
Yes, we've gotten a number of questions already. So just starting off, if someone is approved and they get a letter that says they're approved, that means their benefit starts on July 1st. They can see a doctor on July 1st.
That's correct. They have coverage beginning July 1st. And so I'm happy that they received that letter. Absolutely. Great news.
Are incontinence supplies like underwear, bed pads, and gloves covered for AHE enrollees?
Hello?
Yeah, hi all. The services available under this benefit structure is the same as it is for Apple Health managed care clients today. So yes, generally I will say there is coverage, and you can see our billing guides for more details.
So Colette, that kind of brings me to the next question, asking about a list of benefits or types of services that are specific to this population.
I will point you to our benefit flyer, which I think is one of our links in the chat. So hopefully our team can help copy that back in for us, or I can find that. But the benefit flyer is a great introductory summary for you for the information that was provided today. And again, this structure is set up to mirror that Apple Health managed care structure as much as possible. So if more details are needed, let me know.
You. So we have a question about contracts. How will this affect current contracts with the listed MCOs? Will suppliers be required to update contracts to include AHE enrollees? And if so, will there be a difference in the fee schedule payments for service?
And I think this is specific to managed care organizations. So this is specific to their contracts with their provider networks. And I'm not sure if the MCOs want to answer that live or provide a phone number or a resource for individuals. I will pause and leave that for all of you.
Thanks, Becky. This is Audrey with Molina. I think the answer is probably going to vary a little bit from MCO to MCO, but I think in general, the majority of folks will not have their contract touched with this go live. I think for the most part, this population is going to be rolled in with the general Medicaid population. So that is the good news. If you have a specific question about your contract, I would recommend reaching out to each respective MCO's contracting team. The one exception is I know there's going to be some difference for those of you like rural health centers or federally qualified health centers who receiving a federal encounter payment. That might look a little different. You know, it's going to be probably case by case basis. But if you fit in that category, I would guess that the respective contracting teams from different MCOs might already be reaching out or be reaching out shortly. And again, if you've got questions, go ahead and follow up with your individual contracting reps at each MCO respectively. Thank you.
Thank you, Audrey.
Any other managed care organizations who would like to answer that?
Yeah, I can echo what Audrey said. We don't anticipate touching contracts, but there, maybe some case-by-case questions that come up. And so please reach out to our network team if you do have any questions.
Hi, Becky. This is Tiffany with United Healthcare. We did have to amend our contracts. That mailing for any contract that allowed unilateral amendments went out on 6/7. The fee schedule associated with the Apple Health Expansion product is the same as your Medicaid rates. If you have questions on a unilateral amendment that you receive, there is a specific email address on the cover letter there for you, and those will get disseminated to the appropriate contractor who will get back to you. Any contract that required a bilateral amendment to add this product, those contractors are in the process and have been for a while reaching out to those contracted entities. Thank you.
And I see Trish.
Yeah, we are in the same boat as well. So very, very minimal impact to contracts. So again, if you do have questions, please reach out to our provider relations team. I know the one area that we've kind of been working on around with at least some BHASOs is around some language regarding crisis services that is also covered with this Apple Health expansion population. But again, if you have any questions, please feel free to reach out to our provider relations team, and they're more than happy to support you all in whatever way you need.
Thank you. All right, Sarah.
So this next one is about eligibility. If a patient becomes over income and they report that, will that open up space for someone else? Do they lose their eligibility because of their income?
Eligibility team, did you want to take that one?
Sorry, could you say that one more time?
Yes, if someone reports that they have an update to their income and they're now above that 138% of the federal poverty level, will that slot be open to someone else? Will that person lose their coverage?
Yes, if someone reports a change that would make them ineligible for HE, that spot will open up in theory for someone else to then be able to apply for it.
Thank you.
And Sheldon, I would note too that this is where the Apple Health Expansion Enrollment Management Policy will come into play. And so there is a short-term enrollment management policy that is available on our website right now. We are working with community to build a longer-term enrollment management policy. And like I said before, the eventual goal is that we have an IT-based solution waitlist. And so more to come in that area, but really great question. And thank you so much, Sheldon, for fielding that.
All right, do we have time for one more? Some of these I do think we've talked about because there's been some very specific questions in the chat, such as, is this benefit covered? Is this benefit covered? And I think we talked about that and where you can find that benefit schedule as well.
I would note that we've been popping into the webinar chat links to different spots on our Healthcare Authority website that provides information, including the benefit flyer that Colette referenced, as well as contact information should you have questions after the webinar. I think there are a few very specific questions in the Q&A right now, and we'll work to get answers out to those.
So we just asked a question about, money, reporting a change in income. Are there spin down situations in the Apple Health expansion?
I do not believe there's any spend down pieces of Apple Health expansion. Anyone from my eligibility team have more detail there?
No, that's correct. There's no spin down for Apple Health expansion.
Thanks, Sheldon.
Thank you.
Yep.
And then we have one last question I'm going to highlight. It just came in at the 11:58 mark. This is about pregnancy and postpartum coverage. So this person said that they read once a client's pregnancy and postpartum coverage ends, they would have to apply to be covered again by Apple Health expansion and would go on the wait list for an open spot. So this pregnancy and postpartum can be a little bit of a complicated scenario. So I wanted to bring this one up in our last 2 minutes.
So appreciate that, Sarah. So individuals who are currently covered through Apple Health pregnancy coverage or after pregnancy coverage, whose the duration of that extends past June, July of this year, will, when they lose their coverage and they are eligible for Apple Health expansion, they would be eligible to enroll into the program using our short-term enrollment policy. So I wouldn't call it necessarily waitlist, but I would call it a pathway in to Apple Health expansion should eventual spots open up. Sheldon, would you characterize that any differently?
No, you're correct, Becky.
Yeah. What else should we highlight here, do you think? Anything else?
Not that I can think of off the top of my head, and kind of like you expanded on my answer. We're not really anticipating like a lot of like churn and stuff in the program in the next couple months, but as these spots become available and stuff, like you had mentioned, we're using the short-term plan to try to enroll people from the groups that we've identified. But yeah, I mean, at this point, this is kind of what we've talked about, what we've agreed on. Like, I guess there's a possibility that things could change in the coming months, but this is what we're doing at this point.
Thank you, Sheldon. I appreciate that. Thank you for answering live. I know that's not always easy either. So, and thank you to all of our participants or panelists that have been able to answer live for us. Sarah, I think that brings us right at noon. And so we'll say thank you so much for joining. We really appreciate the participation today. You can see we've got our inbox here should you have any questions. And I would definitely look at the Healthcare Authority's website. It has a number of great resources. We will include this slide deck here in the coming days. Thanks again for your participation and have a wonderful day.